and tell people, here we are. We have Gil and myself giving you a live procedure here on YouTube. So tell your friends, because we're going to be here for a little bit. We have to get the procedure done. So if people come in a little bit late, they'll be able to catch it. People are watching this after the fact. Once it's put up to the YouTube channel, it won't be live, of course, at that time. But when it's being put out live here on a Wednesday afternoon at 3 o'clock Pacific time, you'll actually be able to comment, and we'll respond to it after the procedure, not during.
I hope no.
And who knows, maybe even Gil will answer some questions for you guys. So we actually are. We have 16 people watching us right now. So I'll hand this over to LeeAnn, who will be taking care of our switching here. And
do you have to do something special to see comments?
to see comments, yeah. To see the comments, you have to, let me set this up. Sorry guys, I'm setting this up so LeeAnn can help us with comments when the time comes for the live comments. So they show up over here. All these people have already commented. So Team Epiphany Alex, hey, Hannah, yes. Ty Morgan, hello, Hannah. And the Beatles 50, hi Doc. Hello, all of you. Thank you for greeting us, and Gil. So we actually do have people watching us. Let's go ahead and walk on over here to the table. And we have it sticking out a little bit because of how we'll do the procedure. And sorry about that. So we'll tell people what's going on. You had some skin lesions before that we thought should be checked. Have any of them ever turned out to be any kind of a skin cancer?
No.
No skin cancer. Let me just turn on more light for us. And then we're talking today about this one right here, and we'll have Ian get a real close-up shot of that. He can get, about a 1.5 feet away and then zoom in on it. How long has this been here? Do you know, Gil?
That's been there a while, but it hasn't given me any trouble till recently.
And recently the trouble was the flaking and scabbing, and it would come off. And does it have a feel to it when you touch it that seems to be kind of unique?
Yes, before I would touch it and it would be just a mold, but now it's more flaky. I could feel the scab on it.
Feel it, okay.
It would come off and then it would reappear again.
Okay, well, we'll certainly get that off. We're concerned about the possibility of different types of skin cancer. Probably the skin cancer I'd be most concerned about would be malignant melanoma. Chances are it's not, but we just want to make sure, because that would be a very bad thing to miss. Malignant melanoma, in screening for it, we think of things called the ABCDs, or ABCDE. A is there asymmetry, like if you drew a line down the midline of it, does one half look like the mirror image, or is it a mirror image of the other half? B, border irregularity, is it nice and smooth and round? C, color variation, are there different colors to it or more than one color? D, diameter greater than 4 millimeter. E, evolving color, shape, or size, if it's changed. And you say it's actually kind of changed in the feel of it.
The feel, the texture.
So we will get started by having you lie on your, well, you can lie on your back if you want, with your head on the pillow, but we'll have your head kind of turned so that we can get to it. And I think what we'll do is trade here for a moment and have Ian do the prep. And in fact, I'm going to go do the anesthetic, because you don't want me to do this without anesthetic.
No, I prefer not to.
Okay, so I'm going to do something we've not done before. Since I have the mic on myself, I'm going to carry it over to where I actually draw up the medicine. And the people at home will be able to hear me talking. But we'll come back and you guys will have that all ready to go. So I'm going to just carry this camera with me. This will be kind of interesting. So I'm going to take you guys with me. And we'll do it Casey Neistat style. How's that? There we go. So we're walking through the entire office, and you guys should be able to hear and see me. And I can tell from the tally light that you guys can hear and see me. We're going to walk to the part of the office where we keep the anesthetic and the syringes, and I'll just draw that up for us so that we can get this patient taken care of and make sure that he's numb so that he doesn't feel his procedure being done. Let me put you over here. And I'll kind of lean down so you can see. I get a syringe and some alcohol, And we don't have any controlled substances here. This is just lidocaine is all it is. All right, so get some lidocaine. We actually have a bit of shortage of lidocaine with epinephrine right now. And we've been saving this little bit of lidocaine with epinephrine that we're going to use for Gil. And we'll draw it up here. And this is it. This is all of it. And then something else that I do is I use some sodium bicarbonate to buffer it so that it doesn't sting as much when it goes in. So we get that. And what I put in is about 10% of what the volume is I already have of the anesthetic out of a multi-dose vial and a small needle. And then we're going to walk right back, and hopefully Gil will be ready and be numbed up. Wouldn't that be funny if somebody else walked into the frame? Dr. Gwaine, what are you doing on my live video?
Hey, I'm doing my own.
Which way? Which way do I need to go?
You can go all the way out.
Okay.
So do we
And-
have any more?
And so here it is, right here. Here's the lidocaine with epi. I told you before about the aspirin. I'm going to explain that in a moment.
That makes sense. Mine,
Okay, I have to explain this thing about the aspirin. So if a patient is on aspirin, normally we'll ask them to stop it for, well, I'll just do it for 3 days before doing a procedure like this. But we just scheduled this procedure yesterday, and you know, there wasn't the 3 days to stop the medicine. So we're going to use lidocaine with epinephrine because we're, you know, injecting close to the temporal artery. That's kind of important.
22 watching right now.
So I'll have LeeAnn switch cameras while we give you guys back to Ian so he can carry you. And I'm about to put in the anesthetic. I was just explaining to the people at home that we didn't have you stop the aspirin for anything other than just overnight.
Yes.
So I'm using some epinephrine in this to help to decrease the risk of bleeding.
Why isn't this locking?
Why is it not locking for him? All right, okay, so once you get it in there, then you lock it right here
Gotcha.
and come back around over here. So while I'm numbing you up, Gil, did you have any questions or comments?
No.
LeeAnn, do you have any questions or comments from our friends at home? So I'm gonna give you a shot here.
Other comments about Gwaine, that he was tall and cute.
Gil, do you know Dr. Gwaine?
Mm-mm.
He's the tall.
And somebody thinks that Gil looks very chill on that bed, just laying there.
This is
Pretty
Chill
relaxed.
Gil. What we're seeing is as the medicine goes in, it kind of pushes the lesion upward away from the head, which makes it easier, of course, to do a shave biopsy. And the medicine also makes the surrounding skin a little paler in color as it pushes blood out, and also as the epinephrine takes effect on the blood vessels to constrict them. And that even makes the anesthetic last longer because it doesn't get taken away by the circulation as quickly. We got a little bit dripping down because it's coming out. Putting so much in that it's being pushed out by some hydrostatic pressure. Is that hurting, Gil?
No, it isn't.
Okay. We're actually using just a fraction of what I got. I got 3 cc's. We've only used 2. So I'll put this away using a one-handed recapping technique. Of course, you're never supposed to recap, but I'll use the one-handed technique here. And then once I get the cap on, secure it in place. And then we'll move right on to doing the procedure. So I'm changing out of the non-sterile gloves into the sterile gloves.
Someone else, Audrey asked about no cold spray.
Not on this one, no. There's a number of reasons we don't. One is with a 30 gauge needle, there's not as much need for a cold spray. Another one is the location. It's very close to the eye. and I don't want to get the cold spray all over the eye. I'm going to use my non-sterile hand to grab the tray and bring it over behind us over here. And also I need the specimen container, and I'll just have Ian put that right here probably. Right here would be a good spot. So Gil, we actually have the container for the specimen behind you, so I need you not to kick or wildly flail about during the procedure.
Hope I don't need to.
Yeah, yeah. We sometimes ask patients not to kick and wildly flail about, so this is one of those. I hope that doesn't concern you.
It does.
Okay. All right. So using a couple instruments, we want to kind of stabilize the lesion that we're taking off and get a good sample of it. And Gil, what are you going to do after this? Something, reward yourself somehow for having gone to the doctor's office and had a painful procedure done?
Depending how painful.
Yeah. Are you a little concerned about when we get started?
No.
No. I'm just going to put this here because there's a little bit of blood. And then put the specimen container, put that there, put that there, put that there. And then the wound seal is available. So I'm going to put that in my, what is now not a sterile hand. And take a look at what we have. So there's a little bit of bleeding because we are right on the temporal artery. See if putting pressure on it proximally helps. Does it hurt when I press?
No, it doesn't.
Okay. And what I'm seeing is I did not take the entire lesion off, and we have options here. We can go ahead and finish the procedure with that tiny little speck still there. And if it turns out to be benign, that's fine. I could, if you want, go ahead and get the instruments again, get sterile gloves again, and take that off also. And that way the thing is completely gone, but it means having kind of an irregular shaped and larger place to heal up.
No, this is fine.
Okay, we'll do whatever you want there. Pushing
Please
kind of hard.
ask how long it will be until you get the results back, and Christy says, Gil, you are an awesome trooper.
Gil, do I have your permission to share the results of the biopsy on the description of the video?
Sure.
Then we will have the results after we inform Gil in, let's see, what day is today? Wednesday? I'm going to say by Monday.
And somebody, Pineapple, wondered why you're not shouting.
Why I'm not shouting?
No, I think Gil.
Oh, Gil. I guess he doesn't have a reason to shout.
Not yet. I will when I get the bill.
Okay, I'm going to pour this in, push on it, pour it, and then push down with my hand for about 60 seconds. Can anybody track 60 seconds for me? Does anybody have something that shows seconds? Nobody? I can do it in my head. Maybe we could have you read some comments while...
What else? Somebody asked how long you went to school.
Many years. I'm sorry.
12 years.
There you go. Gil went for 12 years.
Yeah. They're asking about me, aren't they?
Yeah. Yeah, this is the boring part as I count in my head.
And somebody missed the beginning. They were just wanting a recap of what.
Oh, okay, a recap for those who are just coming in because this is a live procedure. Gil came in with a strange lesion on his forehead. You'll have to review back after this is put up again, like maybe Friday afternoon, to see what it looked like. And it was starting to have some strange behavior. It would kind of flake, right? Am I getting that right?
Yes.
It was very black. And so this changing skin lesion that had strange behavior needed to get biopsied. So we just now shaved it off, and it's in a specimen container over here. We just poured on some wound seal to help the wound to stop bleeding and to have a scab on it. You guys can go ahead and take a look really close there. I am now getting out of my sterile gloves and going to throw away the sharps and prepare the specimen because we're just about done here. Before I do the specimen container, let me throw away the sharp. So now we're reaching that part of the procedure where we're going to, I'll actually switch and take the camera from Ian in a moment and take questions. As Ian does the cleanup on Gil, that's kind of the way we split things up here. So we do still have an instrument there. There are some contaminated things there. I'll just put this right here. And I'm going to hand the patient off to Ian.
All right.
So, I'm sorry. Yeah, you want your hand. All right. So I can actually answer questions while Ian works on Gil. Get another view of the wound seal.
When you have it done on the temple like that, is it more dangerous than other places?
Yes, it is. The temporal artery is right under the skin there. You go too deep, and that is really going to bleed. So that was part of the reason that I used our last supply of lidocaine with epinephrine until we get some new. I'm not sure why there's such a problem. I guess the manufacturer is not keeping up with the demand. Ian's coming in now with a little spray. He's going to spray off with air.
All right. So just watch your eyes.
Yeah, we don't want to get in the eye. You see the powder just kind of goes off onto the chucks we have under him, the paper on the table. Gil, can I have you sit upright?
Right, here we go. Let's get the last of that out.
All right.
A couple more people are wondering what's going on. So it's a shave biopsy on the patient's.
We just did a shave biopsy on Gil's left temple, and we put on some wound seal. Ian is now just cleaning up around the wound seal, and we'll get the results on the pathology. I'm going to come around to this side and see. How are you feeling, Gil?
I'm doing fine right now.
Feeling fine is a great answer to get. So I'm much closer than it can focus. I know that. I'm sorry. I'll try to come back here and instead zoom in because that's the way this lens works better. And you should be able.
Powder. It's called wound seal.
Wound seal is the name of it, a commercial product that essentially acts like a scab. It polymerizes on contact with the blood.
Can we show it at all?
And oh yeah, we can. Well, I don't know. Do we want to be that commercial? Yeah, we'll show you what the box looks like. It just looks like that, box of wound seal. And I guess that we'll go ahead and now kind of do a bit of a sign off.
Somebody asked about Ian.
What about
He's
Ian?
wondering how long he's worked here. Said I've never seen him.
Ian has been here for 19 months.
Yeah, 19 months. Yeah.
19 months. And I'll go ahead and hand the camera to Ian for a sign off, unless there's more questions, or even for the questions. Let me hand that to you.
Yeah.
Have you spin that around, and I'll join Gail here on the table of honor. Thanks a lot for doing this.
Yeah.
Appreciate
Yeah,
it.
that's fine.
Any other questions here as we wrap up? Any final comments that LeeAnn can read and we can say out loud? Okay. Thank you so much for joining us. This will probably go out, be available again Friday afternoon at 4 in place of our Friday procedure video. And I don't know, it depends on how good the procedures are between now and then. It may actually be left out and put something else out on Friday. We'll see. We want to especially thank 4 individuals on Patreon: Boo Boo Kitty, Lindsay Antwine, Petra Rosenberg, and Meg Lightbown. Thank you, ladies, very much for your support to help make this possible for people to learn about medical procedures. Gil, again, thank you. You've done this a couple times, and
Yes.
it's been good. Until next time, Dr. Mark Vaughan telling all of you that I'm about to sign off, but I appreciate you watching. Stay in good health.